Hello and welcome to the official YouTube channel of Triune Biblical University Global Extension, USA, where innovation meets education, and learning knows no boundaries. Whether you're a prospective student, a curious learner, or a proud member of our growing global family, we're thrilled to have you here. To our amazing subscribers, thank you so much for your continued support. Your likes, comments, and shares help us reach more learners and inspire more minds every single day. And if you're new here, welcome aboard. Don't forget to hit that subscribe button and tap the notification bell so you never miss out on our latest lectures, updates, expert insights, campus news, and educational content designed just for you. Now, let's dive into today's topic, one you won't want to miss. Today's topic is advanced developmental psychology. Sit back, relax, and enjoy. Class 17 Lecture, Aging and Social Relationships, Family, Friends, and Community. Introduction. Welcome to Class 17 of Advanced Developmental Psychology. In today's lecture, we will focus on the importance of social relationships in late adulthood, examining how family dynamics, friendships, and community involvement contribute to the well-being of older adults. As we have seen in previous classes, aging is not only a time of physical and cognitive change, but it is also deeply influenced by social interactions and relationships. Maintaining strong, supportive connections throughout the later stages of life is critical for emotional and psychological health. In this lecture, we will address the following topics. 1. Family dynamics in late adulthood. The role of family members, particularly adult children, in the lives of older adults. Intergenerational relationships and caregiving. 2. Friendships and social networks. The significance of friendships in late adulthood. How older adults maintain or develop friendships and social networks. The consequences of social isolation. 3. Community involvement and support systems. The role of community centers, volunteering, and civic participation in maintaining mental health. Support groups and formal social services for older adults. By the end of this lecture, you should have a deeper understanding of how social relationships impact aging and the strategies that can be employed to enhance social support systems for older adults. 1. Family dynamics in late adulthood. The family continues to play a central role in the lives of older adults, and family relationships can have both positive and negative impacts on their well-being. As individuals age, family members often become more involved in caregiving, financial support, and emotional guidance. The role of adult children. For many older adults, their adult children are a primary source of emotional support, caregiving, and companionship. The dynamic between older adults and their children changes over time, especially as parents become more dependent on their children for assistance. Caregiving. Adult children often take on the role of caregivers as their parents experience physical or cognitive decline. This can involve helping with daily activities, coordinating medical care, and offering emotional support. Caregiver burden is a common issue for adult children, as caregiving can be physically and emotionally taxing. Emotional support. Adult children may provide emotional comfort, particularly if the older adult is dealing with the loss of a spouse or facing health challenges. Additionally, the presence of adult children can help reduce feelings of loneliness and isolation. Intergenerational relationships. The relationships between older adults and their children often shift as they age. The parent-child relationship, which may have been characterized by dependency in childhood, becomes more egalitarian in adulthood. This change can be challenging for both parties, particularly if the parent is reluctant to accept help. Sibling relationships. In late adulthood, siblings may also become more involved in supporting each other and their aging parents. Sibling relationships can be a source of emotional support, but they can also become strained when disagreements arise regarding caregiving responsibilities or inheritance. Siblings as caregivers. When a parent requires assistance, siblings may need to share the responsibility. This often brings issues such as differing views on caregiving, financial stress, and unequal distribution of labor to the forefront. Conflict and cooperation. The aging process can highlight pre-existing tensions between siblings, but it can also provide an opportunity for reconciliation and increased cooperation. Family therapy or mediation may be helpful in resolving conflicts that arise. 2. Friendships and social networks. Friendships and other social relationships are key components of well-being for older adults. Research consistently shows that older adults with active social networks tend to live longer, experience better physical health, and enjoy higher levels of life satisfaction. The importance of friendships in late adulthood. Friendships continue to be a vital part of social development in later life, providing companionship, emotional support, and opportunities for shared activities. Emotional support. Friends can offer non-judgmental emotional support that can be difficult to find in family relationships. They provide a safe space for older adults to share their fears, anxieties, and joys, without the complications that sometimes arise in family interactions. Shared activities. Older adults often report that having friends with whom they can participate in social activities, e.g., exercise classes, book clubs, travel, etc., enhances their quality of life. These shared activities help to maintain mental and physical health. Social comparison. Friends often engage in social comparison, which can help older adults gauge their own health and functioning in relation to their peers. This comparison can foster motivation and a sense of belonging. Maintaining or developing friendships. As people age, their ability to maintain or develop friendships can be affected by various factors, such as health, mobility, and availability. Social support may need to be actively cultivated in late adulthood. Social media and technology. For older adults, technology can be a powerful tool for staying connected to friends and family. Video calls, social media platforms, and messaging apps can help reduce the barriers posed by physical distance and mobility challenges. Community groups. Joining community organizations or interest-based groups can be an effective way to meet new people and form lasting friendships in later life. These could include religious groups, hobby clubs, or support groups for specific health conditions. See social isolation and loneliness. Loneliness is a significant risk factor for poor mental health and physical health in older adults. Social isolation can result from several factors, including the loss of a spouse, mobility limitations, or a lack of nearby family members. Physical and emotional consequences of isolation. Socially isolated individuals are at higher risk for depression, anxiety, cognitive decline, and physical ailments such as high blood pressure. The experience of loneliness can also increase the risk of death. Interventions. Combating loneliness often requires community-based interventions, including social programs, volunteerism, and accessible transportation services that help older adults remain connected to society. 3. Community involvement and support systems. The role of the broader community is essential in supporting older adults and enhancing their quality of life. Communities can provide valuable resources, from social clubs and recreational activities to formal caregiving services. A role of community centers and social clubs. Community centers, senior centers, and recreational clubs play a pivotal role in maintaining the social health of older adults. Civic engagement. Many older adults continue to engage in volunteer work, advocacy, or other forms of civic participation. This engagement provides a sense of purpose and belonging, which is crucial for mental well-being. Access to resources. Community centers often offer services such as transportation, meals, health screenings, and wellness programs, all of which contribute to the overall health of older individuals. Recreational activities. Community-based recreational programs, such as exercise classes, arts and crafts, or group outings, allow older adults to stay physically active, engage socially, and reduce feelings of isolation. Support services for older adults. Home health care. Many older adults benefit from in-home health care, which can assist with daily living activities and provide medical care. These services help older individuals remain in their own homes and retain some level of independence. Respite care. Caregivers of older adults often require breaks from their responsibilities. Respite care services provide temporary relief to family caregivers, ensuring that both the caregiver and the older adult receive appropriate care and support. Meals on Wheels and other services. Social service organizations, such as Meals on Wheels, provide essential services that deliver food, check in on older adults, and ensure they are not at risk of neglect. The importance of formal caregiving support. As we age, there may be a need for more intensive forms of care, including assisted living, nursing homes, or long-term care facilities. These facilities provide medical, emotional, and physical support for individuals with chronic health conditions or significant disabilities. Nursing homes. These facilities are typically for older adults who require continuous medical care or assistance with daily tasks. Despite the challenges, nursing homes can be an important option for older adults who have no other means of support. In-home care. Some older adults choose to remain at home and receive in-home services. This option allows for more personalized care and may be preferable to institutional settings for those who want to retain their independence. Conclusion. In conclusion, the social relationships that older adults maintain, whether with family, friends, or community members, play an essential role in their overall well-being. Healthy family dynamics, active friendships, and strong community support systems are all factors that help mitigate the negative effects of aging and promote positive aging experiences. By prioritizing social connections and ensuring access to support services, we can enhance the quality of life for older adults and help them navigate the challenges of aging with dignity and support. In our next class, we will explore caregiving in late adulthood, examining both the challenges and rewards of being a caregiver for aging family members and the policies that support caregivers. End of Class 17. Class 18 Lecture: Cognitive Development in Older Adulthood, Memory, Intelligence, and Learning. Introduction. Welcome to Class 18 of Advanced Developmental Psychology. In today's lecture, we will delve into cognitive development in older adulthood, focusing on the key aspects of memory, intelligence, and learning. As we continue our exploration of aging, it's essential to understand the cognitive changes that occur during the later stages of life. While many individuals experience declines in certain cognitive functions, it is also crucial to recognize the variability and plasticity of cognitive aging, as some abilities can remain intact or even improve. We will cover the following topics today. 1. Memory in older adults. Understanding age-related changes in memory, including both declines and preservation. Different types of memory: episodic, semantic, and working memory. Strategies to mitigate memory decline. 2. Intelligence and cognitive abilities in later life. Theories of intelligence and how they apply to older adults. The impact of aging on fluid and crystallized intelligence. The role of education, experience, and lifestyle in preserving cognitive function. 3. Learning in older adulthood. How older adults learn new skills and information. Factors that affect learning abilities in older age. The concept of cognitive reserve and its importance in learning during aging. By the end of this lecture, you should be able to understand how cognitive abilities evolve in late adulthood and the factors that influence the maintenance or decline of these abilities. 1. Memory in older adults. Memory is one of the cognitive functions most often studied in aging research. Older adults may experience age-related changes in memory, but it is important to distinguish between the normal aging process and memory disorders, such as dementia. Types of memory in aging. Episodic memory. This refers to the ability to recall specific events and experiences. Older adults typically experience declines in episodic memory, which is why they may have difficulty remembering recent events or conversations. However, long-term memories, those formed in younger years, tend to be better preserved. Semantic memory. This type of memory involves the recall of general knowledge, facts, and concepts. Unlike episodic memory, semantic memory tends to be more resilient as people age. Older adults often retain a wealth of factual knowledge, even though they may experience difficulty recalling specific events. Working memory. Working memory refers to the capacity to hold and manipulate information in the short term. It involves tasks such as mental arithmetic or remembering a phone number long enough to dial it. Working memory tends to decline with age, making it harder for older adults to process and manage multiple pieces of information simultaneously. Age-related memory changes. Memory changes in later life can vary significantly from person to person. Some individuals experience mild cognitive impairment, MCI, which may involve subtle memory difficulties that are more pronounced than what is considered normal aging, but not severe enough to be classified as dementia. Slower encoding and retrieval. One of the most common age-related changes is a slower speed of processing. Older adults may take longer to encode information into memory, and may have difficulty retrieving it later. This is often referred to as encoding inefficiency. Tip of the tongue phenomenon. Many older adults experience the tip of the tongue phenomenon more frequently when they know something, but cannot quite recall it at the moment. This is more common in older adults than in younger individuals. See mitigating memory decline. While memory loss is often associated with aging, there are several strategies that older adults can use to help preserve or even improve their memory. Cognitive training. Cognitive exercises, such as puzzles, brain games, and memory-enhancing activities, have been shown to improve certain aspects of memory and cognitive functioning in older adults. Engaging in these activities regularly helps maintain mental agility. Healthy lifestyle. Regular physical activity, a nutritious diet, and good sleep hygiene contribute to overall brain health. Exercise, in particular, has been linked to improvements in memory and cognitive function. Social engagement. Maintaining social connections is another important factor. Social interaction helps keep the brain active, reducing the risk of cognitive decline associated with isolation. Mnemonic devices. Using mnemonic techniques, such as visualization, repetition, and chunking, can help older adults remember information more effectively. 2. Intelligence and cognitive abilities in later life. Intelligence in later life is a complex issue, as different aspects of intelligence are affected differently by aging. Theories of intelligence help us understand these differences and why older adults can retain some cognitive abilities while experiencing declines in others. Fluid versus crystallized intelligence. Fluid intelligence. This refers to the ability to reason, solve novel problems, and think abstractly. Fluid intelligence tends to decline with age, especially after middle age. Older adults may find it more difficult to solve new problems or think creatively about unfamiliar tasks. Crystallized intelligence. In contrast to fluid intelligence, crystallized intelligence refers to accumulated knowledge, experience, and skills. This form of intelligence typically remains stable or even increases with age. For example, older adults may have a vast store of knowledge that allows them to perform well in areas such as vocabulary, general knowledge, and decision-making. Cognitive decline versus compensation. While fluid intelligence may decline, older adults often compensate by using their crystallized intelligence. For instance, they may rely on experience and wisdom, rather than rapid problem solving to navigate challenges. B. The role of education and experience. Education and life experience play a significant role in determining the level of intelligence maintained during older adulthood. Lifelong learning and continued mental engagement can help preserve cognitive abilities. For example, higher education. Older adults with higher levels of education may experience less cognitive decline compared to those with lower levels of education. The cognitive demands of academic work can serve as a protective factor. Work and volunteering. Continuing to work or volunteer in intellectually stimulating environments helps maintain cognitive functioning. Engaging in complex tasks at work or through volunteer activities contributes to mental reserve. See cognitive reserve and brain plasticity. Cognitive reserve. This refers to the brain's ability to withstand damage or age-related changes due to the buildup of neural connections and mental resources over time. People with higher cognitive reserve are better able to compensate for cognitive decline. This concept emphasizes the role of mental activity, education, and social engagement in preserving cognitive function. Brain plasticity. The brain's ability to reorganize and form new neural connections is a key factor in cognitive aging. Even as the brain ages, it retains the capacity for plasticity, which allows older adults to learn new information and adapt to new situations. Encouraging learning and mental challenges can help promote this plasticity. 3. Learning in older adulthood. Learning new skills or information becomes increasingly important as people age, both to maintain cognitive function and to adapt to new life circumstances. Understanding how older adults learn is critical to developing effective strategies for educational and intervention programs. Age-related learning challenges. While older adults can continue learning well into later life, certain factors may make learning more challenging. Slower processing speed. As discussed earlier, the speed of processing information tends to slow down in older adulthood. This means that older learners may need more time to process new information. Declines in working memory. With a decline in working memory, older adults may have difficulty holding onto and manipulating multiple pieces of information at once, which can complicate the learning of new tasks. Reduced motivation. Some older adults may feel less motivated to engage in new learning due to a perceived lack of need or the discomfort of unfamiliar tasks. B. Strategies to facilitate learning in older adults. Use of familiar contexts. Presenting new information in contexts that are familiar to older adults, such as drawing upon their prior knowledge or experiences, can make learning more effective. Repetition and practice. Older adults often benefit from repetition and structured practice to solidify learning. Repeating tasks and allowing ample time for mastery can aid retention. Multisensory learning. Engaging multiple senses in the learning process, e.g., visual, auditory, tactile, can enhance memory and understanding. See lifelong learning and educational programs. Lifelong learning opportunities are crucial for promoting cognitive health in older adulthood. Programs designed for older adults, such as community college classes, hobby groups, or online courses, provide cognitive stimulation and social interaction, both of which contribute to positive aging. Conclusion. Cognitive development in older adulthood is multifaceted, involving changes in memory, intelligence, and learning. While some cognitive functions, such as working memory and fluid intelligence, may decline with age, other aspects, such as crystallized intelligence and long-term memory, often remain intact or even improve. The concept of cognitive reserve highlights the importance of continued learning and mental engagement throughout life in preserving cognitive abilities. As we age, it is essential to adopt strategies that support memory and learning, such as engaging in stimulating activities, maintaining physical health, and cultivating social connections. By doing so, older adults can continue to lead mentally active and fulfilling lives. In our next class, we will explore the psychosocial aspects of aging, focusing on the concepts of life satisfaction, identity in later life, and successful aging. End of Class 18. Class 19 Lecture. Emotional Development in Later Life, Coping, Well-Being, and Adjustment. Introduction. Welcome to Class 19 of Advanced Developmental Psychology. Today's lecture will focus on emotional development in later life, a key aspect of successful aging. While much of the developmental literature on older adulthood has emphasized cognitive changes, emotional development is equally critical for understanding how individuals adjust to the challenges of aging. As people move through later stages of life, they continue to experience a wide range of emotions, from joy and contentment to sadness and loss. However, how older adults cope with these emotions and adapt to aging-related changes varies significantly across individuals. In this lecture, we will discuss the following topics. 1. Emotional regulation in older adults. How older adults manage and express their emotions. 2. Well-being and life satisfaction. What contributes to emotional well-being in later life. 3. Coping mechanisms. The strategies older adults use to deal with stress, loss, and change. 4. Adjustment to aging. How older adults navigate the challenges associated with aging, including health problems, retirement, and loss of loved ones. By the end of this lecture, you should have a clearer understanding of how emotional development continues throughout later life and the various factors that contribute to emotional well-being in old age. 1. Emotional regulation in older adults. Emotional regulation refers to the processes by which individuals influence their emotions when they experience them and how they express them. Emotional regulation in older adulthood can be influenced by various factors, including life experience, social support, and cognitive functioning. A. Decreased negative emotions with age. Interestingly, research has shown that negative emotions, e.g., anger, anxiety, sadness, tend to decrease as people age. Older adults report fewer instances of negative emotional experiences than younger adults. Several theories explain this phenomenon. Socio-emotional selectivity theory, Carstensen, 1992. This theory suggests that as individuals age, they prioritize emotionally meaningful relationships and experiences, focusing more on positive emotions, and minimizing exposure to negative emotional stimuli. Older adults often spend more time with close family and friends, engage in activities they enjoy, and focus on the present, rather than future uncertainties. Emotional selectivity. As time horizons shorten, older adults are more motivated to cultivate positive experiences and limit the impact of negative emotions. This may involve engaging in less conflict, focusing on positive memories, or disengaging from stressors that are no longer relevant. Cognitive changes. Cognitive decline in later life, while often associated with certain difficulties, may have an unexpected emotional benefit. Emotional filtering. Older adults may have less concern with external, negative factors, such as societal pressures or financial stress, and more ability to focus on emotional contentment and positivity. Emotional positivity and aging. Older adults generally report greater emotional positivity and contentment. Despite the challenges of aging such as physical decline, retirement, or loss of loved ones, many older adults exhibit a greater capacity for positive emotions. This is often attributed to the mature emotional regulation skills they have developed over a lifetime. These skills allow for better emotion regulation. Older adults are more likely to use adaptive strategies, e.g., reframing, acceptance, to regulate emotions in response to stress or negative life events. Decreased emotional reactivity. Emotional responses to stressors tend to be less intense in older adulthood. Older adults may experience greater emotional stability and less emotional volatility than younger individuals. Greater emotional wisdom. Life experience contributes to a more balanced emotional outlook. Older adults are often able to handle challenging emotions more effectively, draw from past coping strategies, and maintain emotional equilibrium despite difficulties. 2. Well-being and life satisfaction in later life. Well-being and life satisfaction are key components of emotional development. Older adults' well-being is shaped by numerous factors, including health, social relationships, economic stability, and psychological factors, such as self-esteem and perceived control. Determinants of well-being in later life. Health and physical functioning. Physical health is one of the most important determinants of well-being. Chronic illness, disability, or functional decline can significantly impact an individual's quality of life and emotional state. Conversely, good physical health can lead to higher life satisfaction. Social support. Having strong social support networks, family, friends, or community can enhance emotional well-being. Older adults who maintain close social relationships tend to report higher levels of happiness and are less likely to experience depression or isolation. Economic stability. Financial security plays a crucial role in emotional well-being. Retirement, pension income, and financial planning affect older adults' stress levels and their ability to maintain a sense of independence. Older adults who struggle financially may experience increased anxiety, reduced satisfaction, and even depression. Perceived control. Research indicates that older adults who feel in control of their lives, including their health and environment, tend to report better emotional well-being. This sense of control is linked to a greater sense of autonomy, self-efficacy, and optimism. Self-esteem and identity. Older adults with a positive sense of self-worth and a strong sense of identity, based on past achievements, family roles, or personal goals, report higher levels of life satisfaction. Aging can bring a sense of accomplishment and acceptance that boosts overall well-being. The paradox of aging. Greater satisfaction despite declining health. A well-established finding in gerontology is the paradox of aging. Older adults, despite facing physical and health challenges, often report high levels of life satisfaction. This phenomenon can be explained by several factors. Perspective shift. Older adults often view life through a lens of acceptance and gratitude, making them more appreciative of the present moment. Emotional regulation. As discussed earlier, older adults are better at managing negative emotions and tend to focus on positive experiences, contributing to a higher sense of well-being. Adaptation to loss. While aging inevitably involves loss of physical abilities, loved ones, or roles in society, older adults often adapt to these losses more effectively, leading to higher satisfaction despite such challenges. 3. Coping mechanisms in later life. Older adults are often faced with a unique set of stressors and challenges, including health problems, loss of independence, the death of loved ones, and adjustments to retirement. How they cope with these stressors significantly affects their emotional well-being. A common coping strategies in older adulthood. Problem-focused coping. This type of coping involves taking direct action to address a problem or stressor. Older adults who engage in problem-focused coping tend to make active changes in their environment to resolve issues, such as seeking medical advice, modifying their lifestyle, or organizing their financial situation. Emotion-focused coping. Older adults are more likely to use emotion-focused coping when direct problem solving is not possible. This involves managing the emotional distress caused by a situation, such as through acceptance, reframing, or emotional distancing. For example, an older adult may accept the limitations caused by a chronic illness and focus on enjoying their current quality of life rather than focusing on what they have lost. Meaning-based coping. Some older adults cope with adversity by finding meaning in their life experiences. This could include drawing on religious or spiritual beliefs, finding a sense of purpose in volunteer work or family relationships, or reflecting on the value of life's journey. Meaning-based coping can provide psychological resilience and help older adults make sense of loss. B. Social support as a coping resource. Social support plays a crucial role in how older adults cope with stress. Research indicates that older adults who have strong social networks are better equipped to handle emotional challenges. Support from family, friends, and community members offers emotional comfort, practical assistance, and a sense of belonging. See resilience and adaptation. Older adults tend to demonstrate a remarkable degree of resilience, the ability to recover from setbacks, adapt to adversity, and maintain well-being despite challenges. Resilience can be fostered by maintaining a positive outlook on life, engaging in regular social activities, pursuing hobbies and interests that bring joy and fulfillment, seeking professional help for mental health challenges. 4. Adjustment to aging, life transitions and challenges. The process of aging brings a series of life transitions, each of which requires adjustment. These include retirement, changes in physical health, loss of loved ones, and changing roles in society. A. Retirement and loss of role identity. Retirement is a major life transition for older adults, often resulting in a loss of role identity, especially if work was central to their sense of purpose. How well an individual adjusts to retirement depends on several factors. Preparation for retirement. Older adults who prepare for retirement, both financially and emotionally, tend to adjust more smoothly. Subsequent engagement. Staying active through part-time work, volunteering, or hobbies can help maintain a sense of purpose and identity in retirement. B. Coping with loss. Aging often brings the loss of loved ones, which can result in grief and emotional distress. Coping with loss is an ongoing process, and older adults may rely on social support, therapy, and meaning-making to help them navigate grief. Conclusion. Emotional development in later life is shaped by a range of factors, from personal coping strategies to social relationships and life transitions. Older adults often report greater emotional stability and life satisfaction, despite facing physical and emotional challenges. Their ability to regulate emotions, draw on past experiences, and find meaning in life plays a key role in maintaining emotional well-being. In addition, coping strategies such as problem-focused coping, emotion-focused coping, and meaning-based coping help older adults manage stress and adapt to the challenges of aging. In the next class, we will explore aging and social relationships, focusing on family dynamics, friendships, and the role of social networks in promoting healthy aging. End of Class 19. Class 20 Lecture, Aging and Social Relationships, Family, Friendships, and Social Networks. Introduction. Welcome to Class 20 of Advanced Developmental Psychology. Today, we will explore the profound role of social relationships in later life, a topic that is critical to understanding the aging process and its emotional and psychological impacts. As individuals age, their social networks, family dynamics, and friendships evolve, with significant consequences for mental health, well-being, and life satisfaction. Research consistently shows that older adults with strong social connections report better overall health, higher life satisfaction, and lower rates of depression and loneliness. As people enter older adulthood, the quality and quantity of their social relationships may change, but the need for social interaction and meaningful connections remains just as important as in earlier stages of life. In this lecture, we will cover the following topics. 1. The role of family in later life. How family relationships impact aging and emotional development. 2. Friendships in later life. The importance of peer relationships as people age. 3. Social networks and loneliness. The effects of social isolation and the importance of maintaining diverse social networks. 4. Intergenerational relationships. The benefits of relationships across generations, including grandparent-grandchild bonds and caregiving dynamics. By the end of this class, you will have a deeper understanding of how aging impacts social relationships, how these relationships affect well-being, and how older adults can maintain or build meaningful social connections. 1. The role of family in later life. Family is often the cornerstone of an older adult's social support network, providing emotional, physical, and financial support during the aging process. The family is typically the primary source of caregiving when health problems arise, and the dynamics within families can influence emotional well-being significantly. Changing family roles. As individuals age, their roles within the family often shift. These changes can have both positive and negative effects on older adults' emotional and psychological well-being. Common changes include empty nest syndrome. When children leave the home, older adults may experience feelings of loss or a diminished sense of purpose. However, some parents embrace this stage as an opportunity for renewed focus on personal goals or their relationship with their spouse. Grandparenting. Many older adults take on the important role of grandparents. This relationship can be a source of joy and meaning, as it often provides an opportunity to engage in nurturing and supportive roles, without the full-time responsibilities of parenting. Caregiving. Older adults may find themselves becoming caregivers for spouses, aging parents, or other relatives. These caregiving responsibilities can be emotionally demanding, but can also provide a sense of purpose and connection. However, caregiver burnout is a real risk, and support is critical. B. The impact of family on well-being. Family relationships are crucial for emotional well-being in older adulthood. Positive family relationships are associated with better mental health. Older adults with strong family ties tend to experience lower levels of depression and anxiety. Greater life satisfaction. Close, supportive relationships contribute significantly to happiness and overall life satisfaction in later life. Physical health benefits. Emotional support from family members can lower stress and improve physical health outcomes by promoting healthier behaviors and providing caregiving assistance during illness. However, strained family relationships, whether due to unresolved conflicts, distance, or caregiving stress, can lead to negative outcomes, such as increased stress, depression, and isolation. 2. Friendships in later life. Friendships remain important throughout the lifespan, but their role becomes particularly prominent in later life, when individuals may experience a reduction in family-based support. Friendships often provide an emotional outlet, opportunities for companionship, and a sense of belonging that is vital for emotional well-being. The importance of friendships in aging. Emotional support. Friends provide an essential emotional support network, offering understanding and companionship that can mitigate feelings of loneliness and isolation. Shared activities. Friendships in later life often revolve around shared activities such as hobbies, volunteering, or group activities. These interactions promote mental and physical well-being by providing opportunities for social engagement and physical activity. Social integration. Friendships help older adults stay connected to the community and remain socially engaged. This engagement is essential for mental health and reducing the risk of depression. Friendship dynamics in older adulthood. Friendships in later life tend to be characterized by fewer but more meaningful relationships. As people age, they often prioritize quality over quantity in their friendships. They tend to cultivate deeper, more meaningful relationships with a smaller circle of friends. Gender differences. Research indicates that women tend to have larger, more emotionally supportive social networks than men. They are also more likely to maintain close friendships in later life, while men may experience greater social isolation if they lack strong friendships. Loss of friends. Aging often comes with the loss of friends due to health issues, death, or relocation. While some older adults may find it difficult to replace lost friends, others may form new friendships, particularly through community or senior groups. 3. Social networks and loneliness. Social networks, defined as the web of relationships and interactions an individual maintains, are crucial for well-being in later life. Loneliness, often a byproduct of limited social interaction or isolation, is a serious concern among older adults, with significant implications for mental and physical health. The problem of social isolation. Social isolation is defined as the absence of meaningful social relationships. It differs from loneliness, which refers to the subjective feeling of not having sufficient social connections. Social isolation can result from physical disabilities, relocation, loss of a spouse or friends, or limited mobility. Consequences of isolation. Prolonged social isolation has been linked to a range of negative outcomes, including depression, anxiety, cognitive decline, and even physical health problems, such as increased risk of cardiovascular disease. Health risks. Isolated older adults may experience poor sleep quality, higher levels of stress, and a reduced immune response. They may also be at greater risk for developing chronic conditions, due to lack of support for healthy behaviors and self-care. Combating loneliness and isolation. Maintaining and expanding social networks can prevent or mitigate feelings of loneliness and isolation. Strategies include community engagement. Older adults who remain active in their communities through volunteering, attending church, or participating in group activities tend to have more robust social networks and report higher levels of happiness and life satisfaction. Technological tools. The use of technology, e.g., video calls, social media, can help older adults maintain long-distance relationships, especially in the face of mobility challenges or living alone. Support groups. Joining support groups for specific life challenges, e.g., widowhood, chronic illness, can provide emotional connection and a sense of shared understanding. 4. Intergenerational relationships. Intergenerational relationships, or those between older adults and younger generations, e.g., children, grandchildren, and even great-grandchildren, are of particular significance in later life. These relationships provide emotional fulfillment, a sense of continuity, and opportunities for personal growth. The role of grandparents. Grandparents often play a vital role in family dynamics, providing love, guidance, and support to grandchildren. Research shows that grandparents often report higher levels of happiness and satisfaction when they have close relationships with their grandchildren. Transmission of wisdom. Grandparents may pass down knowledge, traditions, and life experiences, which contributes to both their sense of identity and the emotional well-being of younger generations. Emotional support. In addition to their role as caregivers and role models, grandparents can provide emotional stability to grandchildren, especially during times of family crisis or transition. Caregiving across generations. As older adults experience health problems, they may become dependent on their adult children or other family members for caregiving. The caregiving relationship can be both rewarding and stressful, requiring adjustments from both parties. Caregiver stress. Adult children or family members who take on caregiving roles often face significant challenges, including emotional strain, financial burdens, and physical exhaustion. However, some individuals find that caregiving deepens their relationship with the elderly family member and brings a sense of fulfillment. Reciprocity in relationships. The cycle of caregiving where younger generations provide support for older generations can strengthen family bonds. However, it's crucial for families to maintain open communication and share caregiving responsibilities to avoid caregiver burnout. Conclusion. Social relationships in older adulthood are a fundamental aspect of emotional development and well-being. Family relationships, friendships, and social networks provide essential emotional support, contribute to life satisfaction, and help older adults cope with the challenges of aging. Moreover, intergenerational relationships, whether through grandparenting or caregiving, can enrich the lives of both older adults and younger generations. In the next class, we will discuss aging and cognitive health, focusing on how cognitive abilities change in later life, and the strategies for maintaining cognitive function as we age. End of Class 20. Class 21 Lecture, Aging and Cognitive Health, Memory, Attention, and Executive Functioning. Introduction. Welcome to Class 21 of Advanced Developmental Psychology. Today, we turn our focus to the relationship between aging and cognitive health, an essential topic, in understanding how our cognitive abilities change over the lifespan, particularly in late adulthood. As individuals age, there are often noticeable changes in cognitive functioning, such as declines in memory, attention, and executive functioning. However, it's important to note that cognitive aging is not a uniform process. Some individuals maintain high levels of cognitive function into their later years, while others experience more significant challenges. In this lecture, we will 1. Examine the impact of aging on various cognitive domains, focusing on memory, attention, and executive functioning. 2. Explore the mechanisms behind cognitive decline and how these changes relate to the brain's aging process. 3. Discuss strategies for maintaining cognitive health, including physical activity, mental stimulation, and lifestyle factors. 4. Review the distinction between normal aging and pathological decline, such as dementia and Alzheimer's disease. By the end of this class, you will have a deeper understanding of how aging influences cognitive functions, and you will also be equipped with strategies to help preserve cognitive health in later life. 1. Memory and aging. Memory is one of the most commonly affected cognitive functions in older adults. It is important to understand that not all forms of memory are equally impacted by aging. Some types of memory remain relatively stable, while others are more susceptible to age-related decline. A types of memory affected by aging. Working memory. This is the cognitive system responsible for holding and manipulating information over short periods. Working memory tends to show a decline with age, particularly in tasks that require multitasking or holding multiple pieces of information in mind simultaneously. This decline is often due to changes in the prefrontal cortex, which is involved in managing cognitive resources. Episodic memory. Episodic memory refers to the ability to recall specific events or experiences. Aging is often associated with difficulty in remembering events and experiences, especially those that happened recently. This decline may be linked to changes in the hippocampus, a region of the brain involved in forming new memories. Semantic memory. Unlike episodic memory, semantic memory involves recalling facts and general knowledge, e.g., knowing that Paris is the capital of France. Research suggests that semantic memory remains relatively intact in older adults, even as other forms of memory decline. Prospective memory. This type of memory refers to remembering to perform an action in the future, e.g., remembering to take medication. Older adults may experience difficulties with prospective memory, especially when tasks are complex or require a high level of organization. B. Factors influencing memory decline. Several factors can contribute to memory decline as we age, including biological changes, structural and functional changes in the brain, particularly in areas such as the hippocampus and prefrontal cortex, contribute to memory decline. Neurotransmitter systems, such as acetylcholine, which are critical for memory formation, also show changes with aging. Health conditions. Conditions like hypertension, diabetes, and sleep disorders can exacerbate memory problems. Additionally, certain medications can interfere with memory functioning. Lifestyle factors. Lack of physical activity, poor nutrition, and social isolation can also accelerate memory decline. On the other hand, engaging in mentally stimulating activities and maintaining social connections can help preserve cognitive function. 2. Attention and aging. Attention, which involves focusing mental resources on a specific task or stimulus, is another cognitive function that can change with age. Attention is a broad cognitive domain, encompassing sustained attention, selective attention, and divided attention. A. Types of attention affected by aging. Sustained attention. This is the ability to maintain focus on a single task over time. Research suggests that older adults may experience difficulty maintaining sustained attention, especially for long, monotonous tasks. However, this can be mitigated by providing more engaging or stimulating tasks. Selective attention. Selective attention refers to the ability to focus on a particular stimulus while ignoring irrelevant information. Older adults may struggle more with filtering out distractions, which can lead to slower reaction times, and difficulty concentrating in busy or distracting environments. Divided attention. Divided attention refers to the ability to manage multiple tasks simultaneously. Older adults often experience difficulty with multitasking. While younger individuals can switch between tasks rapidly, older adults tend to experience a greater decline in their ability to juggle multiple tasks at once. B. The cognitive mechanisms behind attention decline. As individuals age, there are changes in the dopaminergic system. Dopamine is crucial for attention and motivation, and the prefrontal cortex, which is involved in regulating attention, becomes less efficient. These changes contribute to slower processing speeds and decreased flexibility in managing attention. 3. Executive functioning and aging. Executive functions are a set of high-level cognitive processes that allow us to plan, make decisions, solve problems, and control our impulses. These functions are crucial for goal-directed behavior, and they tend to decline with age. Key aspects of executive functioning affected by aging. Inhibition. This refers to the ability to suppress irrelevant or inappropriate responses. Older adults often find it harder to inhibit automatic responses, which can lead to impulsivity or difficulties in controlling emotions or behaviors. Cognitive flexibility. Cognitive flexibility is the ability to adapt to new or changing situations. Aging is associated with a decline in cognitive flexibility, which may make it harder for older adults to shift between tasks or adapt to new information. Planning and decision-making. Aging may also affect the ability to plan complex tasks and make decisions, particularly in situations that require a high degree of abstract thinking. Older adults may struggle to plan ahead effectively, especially if the tasks are unfamiliar or require multitasking. Brain changes and executive functioning. The decline in executive functioning is primarily attributed to structural changes in the prefrontal cortex, which becomes less efficient with age. Additionally, changes in white matter, the brain's communication pathways, can impair the ability to process information quickly and effectively, which impacts executive functions like decision-making and problem-solving. 4. Maintaining cognitive health. While some cognitive decline is a normal part of aging, research suggests that there are effective strategies for maintaining and even enhancing cognitive function in later life. Physical activity. Regular physical activity, particularly aerobic exercise, has been shown to support cognitive health. Exercise increases blood flow to the brain, promotes neurogenesis, the creation of new neurons, and supports the health of the hippocampus. Engaging in regular exercise can reduce the risk of cognitive decline and improve memory, attention, and executive functioning. Mental stimulation. Engaging in mentally stimulating activities such as reading, playing musical instruments, doing puzzles, or learning new skills can help keep the brain active. Studies suggest that intellectual engagement can create cognitive reserve, which helps protect against the effects of aging on the brain. Social engagement. Maintaining social connections is also vital for cognitive health. Social engagement provides mental stimulation, emotional support, and opportunities for meaningful interaction, all of which contribute to better cognitive function in later life. Healthy lifestyle choices. Other lifestyle factors such as adequate sleep, healthy nutrition, stress management, and avoiding smoking or excessive alcohol consumption are crucial for preserving cognitive health. A balanced diet rich in fruits, vegetables, and healthy fats, such as omega-3 fatty acids, has been associated with better brain health. 5. Normal aging versus pathological cognitive decline. It's important to differentiate between normal cognitive aging and pathological decline, such as dementia or Alzheimer's disease. Normal aging. In normal aging, cognitive decline is typically gradual and may involve mild changes in memory, attention, and executive function. These changes do not significantly impair daily functioning. Pathological decline. Conditions like Alzheimer's disease or vascular dementia involve more severe cognitive impairments that interfere with daily life. Symptoms include profound memory loss, difficulty with communication, disorientation, and impairments in judgment and problem solving. Diagnosis of these conditions is based on comprehensive assessments, including neuropsychological tests, brain imaging, and medical history. Early intervention and lifestyle changes can help manage symptoms and improve quality of life. Conclusion. Cognitive aging is a complex process that involves changes in memory, attention, and executive function. While these changes are a normal part of growing older, there are several strategies such as physical activity, mental stimulation, and social engagement that can help maintain cognitive health and slow down decline. Understanding the distinction between normal aging and pathological conditions is also crucial for supporting older adults in maintaining their independence and quality of life. In our next class, we will dive deeper into age-related cognitive disorders, specifically focusing on Alzheimer's disease, Parkinson's disease, and other forms of dementia. We will discuss their symptoms, causes, and current treatments. End of Class 21. Class 22 Lecture: Age-Related Cognitive Disorders, Alzheimer's disease, Parkinson's disease, and dementia. Introduction. Welcome to Class 22 of Advanced Developmental Psychology. In this lecture, we will focus on age-related cognitive disorders, specifically Alzheimer's disease, Parkinson's disease, and dementia. These conditions are among the most significant causes of cognitive decline in older adults, and understanding them is essential for anyone involved in the care, treatment, or study of aging populations. We will explore 1. The characteristics and symptoms of Alzheimer's disease, Parkinson's disease, and other forms of dementia. 2. The underlying biological and neurological mechanisms that contribute to these disorders. 3. Current diagnostic criteria and tools used to identify these conditions. 4. Treatment options and approaches for managing and slowing the progression of cognitive decline. 5. The psychological and emotional impacts of these disorders on patients and their families. By the end of this lecture, you should have a comprehensive understanding of the most common age-related cognitive disorders, and be equipped with knowledge on how to approach these complex conditions from both a clinical and caregiving perspective. 1. Alzheimer's disease, AD. Overview. Alzheimer's disease is the most common form of dementia, accounting for approximately 60 to 80% of dementia cases. It is a progressive neurological disorder that primarily affects memory, thinking, and behavior. Prevalence. Alzheimer's disease predominantly affects individuals aged 65 and older, though early onset Alzheimer's can occur before the age of 65. Symptoms. The hallmark symptoms of Alzheimer's disease include severe memory loss, confusion, difficulty with language, disorientation, and mood changes. Over time, individuals may lose the ability to recognize loved ones, perform basic tasks, or care for themselves. B. Neurological mechanisms. The primary cause of Alzheimer's disease is the accumulation of amyloid plaques and tau tangles in the brain. These abnormal protein deposits interfere with the functioning of neurons and disrupt communication between brain cells. Amyloid plaques. Amyloid beta protein fragments clump together to form plaques that accumulate between neurons and disrupt synaptic function. Tau tangles. Tau protein, which normally helps stabilize microtubules in neurons, becomes abnormally phosphorylated and forms tangles inside the cells, impairing their function. As a result, there is a significant reduction in the size of the hippocampus, a critical area for memory, and other brain regions involved in cognitive functions. See symptoms progression. Early stage symptoms: short-term memory loss, forgetfulness, difficulty recalling names and appointments, and challenges in learning new information. Middle stage symptoms: increased memory loss, difficulty in recognizing family members, confusion regarding time and place, and frequent mood swings. Late stage symptoms: loss of speech, loss of mobility, and inability to recognize family members or surroundings. Individuals may require full-time care. Diagnosis and treatment. Diagnosis. Diagnosis is typically based on clinical evaluations, neuroimaging, e.g., MRI or PET scans, and neuropsychological tests. There is no definitive test for Alzheimer's, but biomarkers like amyloid beta and tau in cerebrospinal fluid may aid in diagnosis. Treatment. While there is no cure for Alzheimer's, certain medications can temporarily reduce symptoms or slow disease progression. Cholinesterase inhibitors, e.g., donepezil, are commonly prescribed to improve communication between nerve cells. Other treatments focus on managing symptoms such as agitation, depression, and sleep disturbances. 2. Parkinson's disease, PD. Overview. Parkinson's disease is a progressive neurodegenerative disorder primarily characterized by motor symptoms, but can also lead to cognitive decline, including dementia. Prevalence: Parkinson's disease affects about 1% of people over the age of 60. It is more common in men than women. Symptoms: Parkinson's disease presents with motor symptoms such as tremors, rigidity, bradykinesia, slowness of movement, and postural instability. As the disease progresses, individuals may develop cognitive impairments, including memory problems and executive dysfunction. Neurological mechanisms: Parkinson's disease is caused by the degeneration of dopaminergic neurons in the substantia nigra, a part of the brain involved in movement control. Dopamine is a neurotransmitter that facilitates smooth and coordinated muscle movements. Dopamine deficiency: As dopamine-producing neurons die, the brain's ability to coordinate movement diminishes, leading to the motor symptoms seen in PD. Cognitive and mood symptoms often emerge later, as the disease spreads to other areas of the brain. See symptoms and cognitive decline. Motor symptoms: tremors, muscle stiffness, slowness of movement, and problems with balance and coordination. Cognitive symptoms: In later stages, Parkinson's disease can lead to cognitive impairment, including difficulty with attention, planning, memory, and decision-making. Parkinson's disease dementia (PDD) is a subtype of dementia that occurs in up to 50% of individuals with Parkinson's disease. Diagnosis and treatment. Diagnosis: Parkinson's disease is primarily diagnosed based on clinical symptoms, neurological examination, and response to medication. Neuroimaging may be used to rule out other causes of symptoms. Treatment: The primary treatment for Parkinson's disease is the use of dopamine replacement therapy, such as levodopa, which can alleviate motor symptoms. Other medications may help with specific symptoms, such as dopamine agonists and MAO-B inhibitors. Cognitive and psychiatric symptoms may be managed with medications, including antidepressants and antipsychotics. 3. Dementia. Overview. Dementia is an umbrella term for a range of cognitive impairments that interfere with daily functioning, including memory, attention, language, and problem-solving abilities. Alzheimer's disease is the most common form of dementia, but other types include vascular dementia, frontotemporal dementia, and Lewy body dementia. Vascular dementia. Overview. Vascular dementia is caused by reduced blood flow to the brain, leading to the death of brain cells. It often occurs after a stroke or series of mini-strokes, which damage brain tissue. Symptoms. Cognitive symptoms include difficulties with memory, reasoning, and attention. Symptoms often appear suddenly or progress in a step-like manner. See frontotemporal dementia, FTD. Overview. FTD is a rare form of dementia that primarily affects the frontal and temporal lobes of the brain. It often begins in individuals between 40 and 65 years old. Symptoms. FTD is characterized by significant personality changes, impulsive behavior, and language difficulties. Unlike Alzheimer's disease, memory impairment is not typically the first symptom. Lewy body dementia, LBD. Overview. LBD is characterized by abnormal protein deposits called Lewy bodies that accumulate in brain cells, impairing cognitive function. Symptoms. LBD presents with a combination of cognitive decline, motor symptoms similar to Parkinson's disease, and visual hallucinations. It is often misdiagnosed as Parkinson's disease dementia or Alzheimer's. 4. Psychological and emotional impacts. The diagnosis of age-related cognitive disorders like Alzheimer's disease and Parkinson's disease has profound psychological and emotional effects, both on the individual and their family members. Psychological effects on patients. Patients may experience anxiety, depression, and feelings of loss of autonomy, as they realize their cognitive abilities are declining. The loss of independence and the ability to recognize loved ones can lead to profound emotional distress. Caregiver burden. Family members and caregivers often experience significant emotional strain. The responsibilities of caregiving can lead to burnout, stress, and even depression among caregivers, particularly when managing the complexities of progressive diseases. 5. Current and future directions in treatment. While there is currently no cure for most age-related cognitive disorders, research into treatments and potential cures continues to advance. Gene therapy. Investigating gene therapies to slow down or reverse the effects of neurodegenerative diseases is an exciting area of research. Stem cell therapy. Stem cell-based approaches aim to replace damaged neurons and restore lost brain function. Though much of this work is still in the experimental stage, cognitive training, cognitive interventions and training programs aim to improve specific cognitive skills, such as memory and attention, and may help slow cognitive decline in early stages of dementia. Conclusion: age-related cognitive disorders like Alzheimer's disease, Parkinson's disease, and other forms of dementia are complex and devastating conditions that affect millions of individuals worldwide. While there are no cures for these disorders, advancements in early diagnosis, treatment, and care strategies provide hope for improving the quality of life for affected individuals and their families. A better understanding of the biological mechanisms, symptoms, and available treatments will help in both clinical and caregiving contexts, ensuring that those affected can receive appropriate support and intervention. In our next class, we will explore the psychological interventions and therapeutic approaches used to manage these disorders and improve the well-being of older adults. End of Class 22. Class 23 Lecture: Psychological Interventions in Aging, Therapeutic Approaches for Cognitive and Emotional Well-Being. Introduction. Welcome to Class 23 of Advanced Developmental Psychology. In today's lecture, we will explore the various psychological interventions and therapeutic approaches used to support cognitive and emotional well-being in aging individuals. This includes interventions for those with age-related cognitive disorders, as well as general strategies for promoting mental health and quality of life in older adults. We will focus on the following key topics. 1. Cognitive behavioral therapy, CBT, for older adults. How this well-established approach can be adapted to meet the needs of older individuals, particularly in the context of cognitive decline. 2. Interventions for managing cognitive decline, techniques and therapies aimed at maintaining or improving cognitive functions. 3. Emotion-focused therapy and social support, addressing the emotional needs of older adults and the role of social connections in mental health. 4. Interventions for caregivers, the psychological burden on caregivers and how they can be supported in their caregiving role. 5. The role of mindfulness and relaxation techniques, how these approaches can improve well-being and reduce symptoms of depression and anxiety in older adults. By the end of this lecture, you should be familiar with a variety of psychological interventions and strategies that can be implemented to improve the lives of older adults, especially those facing cognitive and emotional challenges. 1. Cognitive behavioral therapy, CBT, for older adults. A overview of cognitive behavioral therapy, CBT. Cognitive behavioral therapy is a widely used therapeutic approach that focuses on identifying and changing negative thought patterns and behaviors that contribute to emotional distress and mental health issues. CBT is evidence-based and has been successfully applied to various conditions, including depression, anxiety, and stress. Core principles: identifying negative or distorted thought patterns, challenging these thoughts to alter the emotional response, encouraging behavioral changes that lead to improved outcomes. B. Adapting CBT for older adults. CBT for older adults may need to be adapted in several ways to be most effective. Pacing and flexibility. Older adults may have slower processing speeds, so therapy sessions should be paced appropriately. Therapy may also need to be more flexible to accommodate physical limitations or cognitive difficulties. Focus on age-related issues. CBT for older adults often centers around life transitions, e.g., retirement, loss of loved ones, dealing with aging-related physical changes, and managing the fear of cognitive decline. Enhancing memory and attention. CBT for older adults can include specific strategies to help them manage memory challenges, such as using cognitive restructuring to address negative thinking related to memory loss. See benefits of CBT for older adults. Reduction in depression and anxiety. CBT has been found to be effective in reducing symptoms of depression and anxiety in older adults, particularly when dealing with the challenges associated with aging. Improvement in coping skills. It helps older adults develop adaptive coping strategies for managing stress, loss, and grief. Increased self-efficacy. CBT empowers individuals to feel more in control of their thoughts and behaviors, leading to improved well-being. 2. Interventions for managing cognitive decline. A. Cognitive training and rehabilitation. Cognitive training involves structured activities designed to enhance specific cognitive abilities, such as memory, attention, and problem solving. These interventions may be used to slow the progression of cognitive decline or maintain current cognitive function in individuals with dementia or mild cognitive impairment, MCI. Memory training. Techniques such as spaced retrieval, a method of prompting individuals to remember information over increasing intervals, and mnemonic strategies, e.g., using visual cues or associations, can help individuals improve their recall. Attention and executive function training. Tasks designed to improve focus, decision-making, and planning skills are especially important for individuals experiencing cognitive decline. Training programs may involve activities that require multitasking or problem-solving. Cognitive rehabilitation. This is a more intensive approach that involves working with a trained therapist to develop strategies for managing daily activities and compensating for cognitive limitations. Reality orientation therapy. Reality orientation therapy aims to reduce confusion and improve cognitive functioning by orienting individuals to time, place, and person. It involves regular reminders about where the person is, who they are, and what is happening in their environment. This can help individuals with severe cognitive impairment feel more grounded and secure in their daily lives. Applications. This technique is often used in the early to middle stages of dementia, especially in institutional settings like nursing homes. See cognitive behavioral interventions for cognitive decline. Cognitive behavioral interventions are not only useful for emotional issues, but can also be applied to address cognitive issues. For example, restructuring negative thoughts about one's cognitive abilities can reduce anxiety and help patients engage more actively in cognitive exercises. Cognitive restructuring, helping individuals recognize and change negative beliefs about memory or cognitive function that may hinder their efforts to stay mentally active. 3. Emotion-focused therapy and social support. Emotion-focused therapy, EFT. Emotion-focused therapy is an approach that emphasizes the importance of processing emotions in a healthy way. For older adults, particularly those facing significant life changes, EFT can be beneficial in addressing unresolved emotions related to aging, loss, and identity. Goal: EFT aims to help individuals become more aware of their emotional responses, process complex feelings such as grief or fear, and find healthier ways to express and regulate emotions. For older adults may be dealing with multiple losses, e.g., death of a spouse or close friends, and can benefit from learning how to process grief in a supportive environment. The role of social support. Social support is crucial for maintaining emotional well-being in later life. Strong social networks can act as protective factors, reducing the risk of depression, loneliness, and isolation. Social networks. Maintaining meaningful relationships with family, friends, and the community is associated with better mental health outcomes. Group therapy and support groups. Group interventions allow older adults to connect with others who are experiencing similar challenges, reducing feelings of isolation and providing emotional validation. Intergenerational relationships. Encouraging intergenerational connections can provide emotional support and foster a sense of purpose and fulfillment in older adults. 4. Interventions for caregivers. Caregiver stress and burnout. Caregivers of older adults, particularly those caring for individuals with dementia, often experience significant psychological strain, which can lead to burnout, depression, and anxiety. Stress management. Training caregivers in relaxation techniques, stress management, and coping skills can help reduce the psychological burden. Support for caregivers. Caregivers can benefit from support groups, therapy, and respite care, which provides temporary relief from caregiving responsibilities. Programs focusing on caregiver education and emotional support can help reduce feelings of isolation and inadequacy. Psychoeducation for caregivers. Providing caregivers with knowledge about the conditions they are managing, such as Alzheimer's or Parkinson's disease, can help them feel more competent in their caregiving roles. Education on disease progression. Understanding the expected stages of the condition can help caregivers better prepare for upcoming challenges and reduce feelings of frustration. Coping strategies. Teaching caregivers how to recognize and manage their own emotional responses can help improve their emotional resilience and prevent burnout. 5. Mindfulness and relaxation techniques. Mindfulness-based stress reduction, MBSR. Mindfulness-based stress reduction, MBSR, is an evidence-based intervention that focuses on cultivating mindfulness through meditation, breathing exercises, and body awareness. MBSR has been shown to reduce symptoms of anxiety, depression, and stress, making it a valuable tool for older adults. Benefits: MBSR can help older adults cope with chronic pain, cognitive decline, and the emotional challenges of aging. It encourages present moment awareness and non-judgmental acceptance, which can foster greater emotional resilience. Relaxation techniques. Techniques such as deep breathing, progressive muscle relaxation, and guided imagery can help reduce physical and emotional tension. These approaches are especially useful for managing anxiety and improving sleep in older adults. Conclusion: psychological interventions play a crucial role in improving the well-being of older adults, especially those experiencing cognitive decline and emotional challenges. Through the use of cognitive behavioral therapy, cognitive training, emotion-focused therapy, social support, caregiver interventions, and mindfulness techniques, we can help older individuals maintain a high quality of life and manage the challenges of aging. In our next class, we will delve deeper into the ethical considerations in aging research and the impact of societal norms on the aging experience. End of Class 23. Class 25 Lecture: Ageism and its Impact on Psychological Well-Being. Introduction. Welcome to Class 25 of Advanced Developmental Psychology. In today's lecture, we will explore the concept of ageism, prejudice, and discrimination based on age and its profound impact on the psychological well-being of older adults. Ageism can manifest in various ways, from subtle biases in day-to-day interactions to more overt forms of societal discrimination, and it can influence both the mental health of individuals and the ways in which they are treated in society. This lecture will focus on 1. Defining ageism and understanding its origins. 2. The psychological impact of ageism on older adults. 3. The role of internalized ageism and its effects on self-esteem and identity. 4. Ageism in society: how stereotypes, media, and policies contribute to negative attitudes. 5. Strategies for combating ageism at the individual and societal levels. By the end of this class, you should have a clearer understanding of the various forms of ageism, the psychological consequences for older individuals, and the steps that can be taken to reduce its prevalence and negative effects. 1. Defining ageism. What is it and where does it come from? Understanding ageism. Ageism refers to the stereotyping, prejudice, and discrimination against people based on their age, particularly toward older adults. It involves negative attitudes and beliefs about aging and older individuals, often rooted in stereotypes that paint older people as frail, dependent, and less capable than younger individuals. Stereotypes. Common stereotypes about older adults include the belief that they are forgetful, incapable of learning new skills, or disengaged from society. These stereotypes can manifest in everyday conversations, media portrayals, and institutional policies. Prejudices. Ageist prejudices are often based on the assumption that older adults are inferior to younger adults in terms of physical and cognitive abilities, productivity, and societal value. Discrimination. Age discrimination occurs when individuals are treated unfairly because of their age. This can happen in employment, healthcare, social services, and even within families. It might include exclusion from certain opportunities or being overlooked for promotions based on assumptions about age-related decline. Origins of ageism. Ageism is deeply embedded in societal structures and culture. Factors contributing to ageism include cultural ideals of youth and beauty. Many societies, particularly in Western cultures, place a premium on youthfulness and beauty. As people age, they may be devalued because they no longer meet these societal ideals. Economic and workforce trends. Economic shifts, such as the rise of technology and changing job markets, can lead to older workers being seen as less adaptable or valuable. This can perpetuate discrimination in the workforce. Fear of aging. Ageism may stem from society's collective fear of aging and death. This fear can manifest in the devaluation of older adults, as society struggles to come to terms with the inevitability of aging. 2. Psychological impact of ageism on older adults. Mental health consequences. The psychological effects of ageism are profound and can have long-lasting impacts on older adults' mental health. Studies have shown that older adults who experience discrimination based on their age are at higher risk for a range of psychological issues, including depression and anxiety. The experience of being devalued and excluded from society can contribute to feelings of sadness, hopelessness, and fear. Discriminatory practices and attitudes can lead to a heightened sense of isolation, which often exacerbates depression and anxiety. Low self-esteem. Internalized ageism, or the process by which older adults adopt ageist stereotypes about themselves, can negatively affect self-esteem. When individuals begin to believe that they are no longer valuable or capable due to their age, it can diminish their sense of self-worth. Loneliness and social isolation. Ageism can result in older adults being excluded from social activities, opportunities for work, and even informal social gatherings. This isolation can lead to loneliness, which is strongly associated with a range of mental health problems, including depression and cognitive decline. Cognitive decline. Research has shown that ageist beliefs about older adults, such as the idea that aging inevitably leads to cognitive decline, can actually accelerate cognitive deterioration. The belief in one's decline may reduce motivation and exacerbate cognitive decline due to reduced self-efficacy. Impact on health behaviors. Ageism can also have a negative impact on health behaviors. Older adults may avoid seeking medical treatment, exercise, or social interaction due to the belief that they are too old or that their health problems are inevitable. This can lead to physical decline, further exacerbating the social isolation and psychological consequences. 3. Internalized ageism. When older adults believe the stereotypes. The process of internalization. Internalized ageism occurs when older individuals adopt negative stereotypes and prejudices about their own age group. This phenomenon can be damaging, as it not only reinforces ageist attitudes, but also affects self-esteem, motivation, and overall mental health. Self-stigma. Older adults who internalize ageist views may feel ashamed of their age or physical limitations, and may withdraw from social activities or opportunities. This self-stigma can prevent them from seeking help, engaging with others, or even participating in daily activities, contributing to further social isolation. Behavioral consequences. Internalized ageism can also lead to negative behaviors. For example, older adults may stop participating in physical activity because they believe that exercise is pointless at their age, or they may avoid new technology because they assume they are incapable of learning. Combating internalized ageism. It is important to create spaces where older adults can challenge the negative beliefs they hold about aging. Support systems, such as therapy, peer groups, and community programs, can help older adults rebuild their self-esteem and reframe their views about aging in more positive, empowering ways. 4. Ageism in society. How media policies and stereotypes perpetuate negative attitudes. Media representations of older adults. The portrayal of older adults in the media often reinforces ageist stereotypes. Many advertisements, television shows, and movies portray aging individuals as frail, dependent, and out of touch with the modern world. These representations can lead to negative public perceptions of older adults and reinforce the notion that aging is something to be feared or avoided. The fountain of youth culture. In Western cultures, the media often promotes a narrative that aging is undesirable, contributing to societal fear of getting older. This focus on youth as an ideal undermines the contributions and value of older adults in society. Policy and legal discrimination. In addition to media representation, certain public policies can perpetuate ageism. Mandatory retirement ages, for example, force older workers out of the workforce based on arbitrary age limits, rather than their actual abilities or health. Similarly, healthcare policies that fail to address the specific needs of older adults may perpetuate inequalities in care. See stereotyping in everyday life. Ageism is also evident in everyday interactions. Whether through condescending language, assumptions about competence, or a lack of accessibility in public spaces, older adults often encounter societal barriers that limit their opportunities and potential. These microaggressions can compound the psychological distress caused by overt forms of age discrimination. 5. Strategies for combating ageism. Individual-level interventions. To address internalized ageism, older adults and their support systems can work to challenge negative stereotypes. Engaging in positive self-talk and reframing aging as a process of continued growth and possibility can help older adults overcome internalized ageism. Promote lifelong learning and engagement. Encouraging older adults to pursue new skills, hobbies, and social connections can counter the notion that aging brings inevitable decline. B. Societal-level interventions. At the societal level, several strategies can help reduce ageism. Public awareness campaigns. Media outlets and community organizations can highlight positive portrayals of aging, showcasing older adults as active, capable, and valuable members of society. Policy reform. Advocating for changes in policies, such as removing age-based discrimination from employment laws, increasing access to age-appropriate healthcare, and promoting intergenerational activities, can help combat structural ageism. Educational programs. Schools, workplaces, and community centers can implement training programs to educate people about ageism and its harmful effects, fostering a more inclusive environment for all age groups. Conclusion. Ageism is a pervasive issue that affects both the individual and society at large. The psychological toll of ageism on older adults cannot be overstated, and addressing this issue requires a multifaceted approach. By challenging stereotypes, reframing aging as a dynamic process, and advocating for systemic change, we can create a more equitable and inclusive society for individuals of all ages. In our next class, we will dive deeper into the effects of social isolation on aging, exploring how this pervasive issue affects mental health and strategies for combating loneliness in older adulthood. End of Class 25. Class 26 Lecture. The Impact of Social Isolation on Aging. Introduction. Welcome to Class 26 of Advanced Developmental Psychology. Today, we will focus on a crucial aspect of aging: social isolation. As we've discussed in previous classes, older adults can face a range of psychological challenges, and social isolation is one of the most significant. Social isolation can contribute to various negative health outcomes, including physical and mental health decline. In this lecture, we will explore the effects of social isolation on aging, the risk factors that contribute to it, and strategies for alleviating its impact. By the end of this session, you should be able to understand the different dimensions of social isolation and how they manifest in older adults. Identify the psychological and physical consequences of prolonged isolation. Explore ways in which society and individuals can reduce social isolation through interventions and support systems. 1. Defining social isolation. What is it and how does it affect older adults? Understanding social isolation. Social isolation refers to the lack of social interactions and relationships with others. It can be both an objective and subjective experience. Objective social isolation occurs when individuals have fewer social contacts, limited social interactions, and reduced involvement in community activities. Subjective social isolation, or loneliness, is the perception of being isolated, even if an individual's social network is intact. It is the emotional experience of feeling disconnected from others, regardless of actual contact. Both forms of isolation can be harmful to older adults, but subjective isolation, loneliness, often has a more profound impact on well-being. B. The concept of loneliness versus social isolation. Loneliness is the feeling of sadness or distress over a lack of meaningful social relationships. It can be experienced by anyone, even those who are not objectively isolated, if they perceive their social interactions to be insufficient. Social isolation, on the other hand, refers to the actual lack of social connections, such as not having friends, family, or community involvement. While loneliness and social isolation are related, they are distinct experiences. Some individuals may be socially isolated but not feel lonely, while others may experience loneliness despite being socially connected. 2. The risk factors for social isolation in older adults. Physical health decline. Older adults with chronic illnesses, disabilities, or physical impairments are at higher risk for social isolation. Physical limitations can reduce mobility, making it difficult for individuals to leave their homes, attend social gatherings, or engage in activities that promote social connection. Mobility issues. For example, individuals with arthritis, visual impairments, or other mobility challenges may find it difficult to go out or participate in community events. Chronic conditions. Conditions like heart disease, diabetes, or dementia can limit one's ability to engage in social activities, leading to withdrawal from social interactions. B. Loss of loved ones. Another significant factor contributing to social isolation in older adults is the loss of loved ones, particularly spouses or close friends. As people age, they often experience the death of family members or peers, which can reduce their social network. Spousal loss. The death of a spouse or long-term partner can create profound feelings of grief and loneliness. The emotional toll of losing a spouse, combined with the potential reduction in daily social interactions, can lead to isolation. Decreased social circle. As peers age, they may also experience health issues or pass away, leading to a shrinking social circle. Older adults who have outlived their social support networks are more likely to become isolated. See cognitive decline. Cognitive decline, including conditions like dementia, can also lead to social isolation. As cognitive abilities decline, individuals may find it difficult to communicate effectively or engage in social activities. Difficulty with communication. Dementia and other cognitive impairments can lead to difficulties in understanding or processing social cues, making it challenging to maintain relationships. Embarrassment or fear of judgment. Older adults with cognitive decline may withdraw from social situations out of embarrassment or fear of being judged by others. D. Living arrangements and environmental factors. Living alone is one of the strongest risk factors for social isolation in older adults. Those who live alone may have fewer daily interactions with others and are more likely to experience loneliness. Living in rural or isolated areas. Older adults living in remote areas or without easy access to public transportation may have fewer opportunities for social engagement. Institutional living. While some older adults live in nursing homes or assisted living facilities, these environments can be isolating if not designed with social engagement in mind. Loneliness can be common in institutional settings if there is a lack of meaningful activities or social connections. 3. The psychological and physical consequences of social isolation. A. Mental health consequences. The psychological effects of social isolation are profound and far-reaching. Depression. Loneliness is strongly linked to depression. A lack of social support and meaningful relationships can contribute to feelings of hopelessness, sadness, and worthlessness. Anxiety. Isolated older adults may experience increased anxiety, particularly about their future, health, or the fear of dying alone. The stress of social isolation can exacerbate feelings of vulnerability. Cognitive decline. Prolonged isolation is associated with cognitive decline. Social interaction and mental stimulation are essential for maintaining cognitive health, and isolation can deprive individuals of these factors. The lack of social engagement can contribute to the acceleration of cognitive impairment, particularly in older adults with pre-existing conditions like dementia. B. Physical health consequences. The physical toll of social isolation is equally concerning. Increased risk of chronic conditions. Isolated individuals are at a higher risk for developing chronic health problems, such as cardiovascular disease, hypertension, and obesity. Social isolation may reduce motivation to engage in healthy behaviors, such as exercise, eating well, and seeking medical care. Reduced immune function. Research has shown that social isolation can weaken the immune system, making older adults more susceptible to illnesses and infections. Early mortality. Numerous studies have found that prolonged social isolation is associated with an increased risk of mortality. The absence of social relationships and support networks can contribute to a shorter lifespan. 4. Addressing and alleviating social isolation in older adults. A. Social support systems. Creating and maintaining social support systems is crucial in reducing the risk of isolation. Support can come in various forms, such as family, friends, neighbors, or community groups. Family and friends. Encouraging regular contact with loved ones is key to ensuring that older adults have consistent social interactions. Family members can play a critical role in helping older adults remain engaged and connected. Community programs. Senior centers, clubs, and volunteer organizations can provide opportunities for socialization and engagement in meaningful activities. Many communities offer programs specifically designed to combat isolation among older adults. B. Technology as a tool for connection. The use of technology can help bridge the gap for older adults. who may have difficulty leaving their homes. Virtual communication tools such as video calls, social media, and online communities can help isolated individuals stay connected with family and friends. Digital literacy programs, offering programs to teach older adults how to use technology, can help them become more independent and better able to stay in touch with loved ones. Telehealth. Virtual healthcare services allow older adults to access medical consultations without leaving home, helping to maintain their physical health while avoiding the isolation that can occur from travel difficulties. See interventions in institutional settings. For older adults living in nursing homes or assisted living facilities, creating environments that promote social interaction is essential. Structured activities. Providing group activities like games, exercise classes, and social events can reduce isolation in institutional settings. Person-centered care. Tailoring care to the individual needs of residents and promoting one-on-one interactions with staff can help reduce feelings of loneliness and encourage a sense of belonging. Conclusion. Social isolation is a significant concern for older adults, with far-reaching psychological and physical consequences. It is essential to understand the factors that contribute to isolation and loneliness in later life, and to implement strategies that foster social engagement and support. Through community involvement, technological solutions, and thoughtful interventions, we can mitigate the effects of isolation and help older adults lead more fulfilling, connected lives. In the next class, we will explore age-related cognitive decline and the interventions that can support cognitive health in aging. End of Class 26. Class 27 Lecture, Age-Related Cognitive Decline and Interventions. Introduction. Welcome to Class 27 of Advanced Developmental Psychology. In this session, we will focus on one of the most studied and impactful aspects of aging: cognitive decline. As individuals age, they may experience various cognitive changes, ranging from mild forgetfulness to more severe conditions like dementia. It is crucial to understand the factors that contribute to cognitive decline, as well as the strategies and interventions that can support and potentially delay its onset. By the end of this class, you should be able to understand the nature of age-related cognitive decline and the different types of cognitive impairments that can occur. Identify the biological, psychological, and environmental factors contributing to cognitive decline. Explore current interventions and research aimed at supporting cognitive health in aging populations. 1. The nature of age-related cognitive decline. Types of cognitive decline. Cognitive decline in aging can manifest in various forms. The most common types include: 1. Mild cognitive impairment, MCI. MCI is characterized by noticeable memory problems that are greater than expected for a person's age, but not severe enough to interfere with daily life. People with MCI may have difficulty remembering recent events or appointments, but they can still function independently. MCI can progress to more severe forms of cognitive impairment, but not everyone with MCI will go on to develop dementia. 2. Dementia. Dementia refers to a significant decline in cognitive function that interferes with daily activities. The most common type of dementia is Alzheimer's disease, but there are other forms, such as vascular dementia, Lewy body dementia, and frontotemporal dementia. People with dementia experience severe memory loss, confusion, difficulty with decision-making, and changes in personality and behavior. 3. Normal age-related cognitive changes. Aging naturally results in some cognitive changes, but these are usually mild and do not interfere with a person's ability to live independently. For example, slowing down in processing speed or experiencing occasional forgetfulness. These changes are part of the natural aging process and are often seen as part of the normal cognitive aging spectrum. Characteristics of age-related cognitive decline. Cognitive decline due to aging typically involves several key cognitive domains. Memory, one of the most affected areas, particularly working memory, short-term memory, and episodic memory, memory of personal events. Attention and concentration. Older adults may experience difficulties with sustained attention or multitasking. Processing speed. Older adults tend to process information more slowly, which can affect problem-solving and decision-making. Executive functioning. Older adults may experience difficulty with higher-order cognitive processes like planning, organizing, and making decisions. While these changes are common, Not all older adults will experience significant cognitive decline. There is considerable variability in how cognitive aging manifests across individuals. 2. Biological and psychological factors contributing to cognitive decline. Biological factors. Several biological processes contribute to cognitive decline in aging. 1. Brain structural changes. As people age, certain regions of the brain, particularly those involved in memory and processing speed, e.g., the hippocampus, may shrink in size. Neurofibrillary tangles and amyloid plaques, associated with Alzheimer's disease, can disrupt brain function and contribute to cognitive decline. 2. Reduced neuroplasticity. Neuroplasticity refers to the brain's ability to reorganize and form new neural connections. As we age, the brain's neuroplasticity declines, making it more difficult to learn new information and adapt to new situations. 3. Decreased neurotransmitter activity. Neurotransmitters like acetylcholine and dopamine, which are essential for memory, attention, and executive function, decrease in quantity with age. This reduction can impact cognitive abilities such as memory and problem solving. 4. Vascular changes. Age-related changes in blood vessels can affect the brain's blood supply, leading to vascular dementia. This condition arises from reduced oxygen and nutrients to the brain, leading to cognitive deficits. Psychological and environmental factors. In addition to biological factors, psychological and environmental influences play a crucial role in cognitive decline. 1. Stress and mental health. Chronic stress and depression are strongly linked to cognitive decline. Prolonged periods of stress can negatively affect the hippocampus, the brain region responsible for memory. Depression can also lead to cognitive difficulties, often referred to as pseudodementia. 2. Social engagement and cognitive reserve. Social engagement, physical activity, and intellectual stimulation contribute to cognitive reserve, which can help protect against cognitive decline. Cognitive reserve refers to the brain's ability to adapt and function effectively despite age-related changes or brain damage. 3. Educational and occupational background. Higher levels of education and intellectually stimulating work can help maintain cognitive function in older adulthood. Engaging in mentally stimulating activities throughout life can build cognitive reserve and delay the onset of cognitive decline. 4. Lifestyle factors. Diet, exercise, sleep quality, and substance use, e.g., alcohol, tobacco, can have significant effects on cognitive health. Research suggests that healthy lifestyle choices including regular physical exercise, a balanced diet, and good sleep hygiene can slow down cognitive decline. 3. Intervention strategies for cognitive health in aging. Although cognitive decline is a natural part of aging for some individuals, there are interventions that can help mitigate its effects. These interventions fall into several broad categories. Cognitive training and mental stimulation. 1. Cognitive exercises. Engaging in mentally stimulating activities, such as puzzles, reading, learning new skills, or playing memory games, can help maintain cognitive function. Research supports the idea that brain exercises can enhance cognitive reserve and delay age-related cognitive decline. 2. Lifelong learning. Continuing education programs, such as adult learning courses, can keep the brain active and help older adults develop new cognitive skills. Lifelong learning promotes neural connectivity and supports cognitive health. 3. Computerized cognitive training. Digital platforms offering cognitive training programs, e.g., brain training apps, have been shown to improve aspects of memory, attention, and processing speed. These programs are designed to stimulate specific cognitive functions and may have benefits for those at risk for cognitive decline. Physical exercise. 1. Aerobic exercise. Regular physical activity, especially aerobic exercise, e.g., walking, swimming, cycling, has been shown to have positive effects on brain health. Exercise improves blood flow to the brain, encourages neurogenesis, and supports brain structure and function. 2. Strength training. Studies indicate that strength training may also have cognitive benefits. Older adults who engage in resistance training show improvements in memory, executive function, and processing speed. 3. Balance and coordination exercises. Exercise that improves balance and coordination, such as Tai Chi or yoga, may reduce the risk of falls and support overall physical and mental well-being. See pharmacological interventions. While there is currently no cure for dementia, certain medications can help alleviate symptoms or slow progression. 1. Cholinesterase inhibitors. Drugs like donepezil and rivastigmine are often prescribed to people with Alzheimer's disease to increase levels of acetylcholine, a neurotransmitter involved in memory. 2. NMDA receptor antagonists. Memantine is used to treat moderate to severe Alzheimer's disease. It works by regulating the activity of glutamate, a neurotransmitter involved in learning and memory. 3. Anti-inflammatory agents. Emerging research suggests that inflammation in the brain may contribute to cognitive decline. As a result, anti-inflammatory treatments, including certain dietary supplements, are being explored as potential interventions. Social engagement and support networks. 1. Social activities. Maintaining social ties and engaging in community activities are essential for cognitive health. Social interaction provides mental stimulation and emotional support, which can buffer against stress and cognitive decline. 2. Support groups. For individuals experiencing early signs of dementia or MCI, support groups offer a space to share experiences and receive guidance from others in similar situations. Dietary interventions. 1. Mediterranean diet. The Mediterranean diet, rich in fruits, vegetables, whole grains, olive oil, and fish, has been associated with a reduced risk of cognitive decline. Antioxidants and omega-3 fatty acids in this diet may support brain function. 2. Supplements. Some studies suggest that supplements like vitamin D, B vitamins, and omega-3 fatty acids may benefit cognitive health, though the evidence is still mixed. 4. Future directions in research and interventions. Research into cognitive aging and interventions is ongoing, and we are beginning to understand more about how to preserve cognitive function in older adults. Some promising areas of research include neuroplasticity and brain training, exploring ways to enhance brain plasticity in aging adults through targeted interventions and brain training. Genetic research, investigating genetic predispositions to cognitive decline, and finding potential ways to intervene early based on genetic risk factors. Stem cell therapy. In the future, stem cell therapy could play a role in regenerating neurons and treating neurodegenerative diseases like Alzheimer's. Conclusion. Cognitive decline in aging is a complex phenomenon influenced by biological, psychological, and environmental factors. While cognitive decline is often a natural part of aging, there are a variety of interventions ranging from cognitive training and physical exercise to pharmacological treatments that can help delay or reduce its impact. As research continues to evolve, we gain more insight into how we can support cognitive health in older adults and improve quality of life in the later years. In our next class, we will explore the biological underpinnings of aging, particularly focusing on the cellular processes involved in the aging process and how they impact cognitive function. End of Class 27. Class 28 Lecture, Biological Underpinnings of Aging and Cognitive Function. Introduction. Welcome to Class 28 of Advanced Developmental Psychology. In this lecture, we will delve into the biological processes that contribute to aging, with a specific focus on how these processes affect cognitive function. As we age, our bodies undergo significant biological changes that influence not only our physical health, but also our cognitive abilities. Understanding the biological basis of aging can provide insights into the mechanisms behind age-related cognitive decline and help inform interventions to mitigate these effects. By the end of this class, you should be able to identify key biological processes involved in aging and how they affect the brain. Understand how aging-related changes in the brain contribute to cognitive decline. Explore emerging research on aging and its implications for cognitive health. 1. Theories of biological aging. Biological aging refers to the gradual deterioration of physiological functions over time. Several theories attempt to explain the mechanisms of aging, and these theories can help us understand the underlying biological processes that affect cognitive decline. Agenetic theories of aging. 1. Programmed aging theory. According to this theory, aging follows a genetically programmed timeline. This implies that there are certain genes that regulate the aging process, and that the body is programmed to age over time. The Hayflick limit, for example, refers to the idea that cells can only divide a certain number of times before they stop dividing, which contributes to aging at the cellular level. 2. Telomere shortening theory. Telomeres are protective caps on the ends of chromosomes that prevent the degradation of genetic material during cell division. As cells divide over time, telomeres shorten, which leads to cellular senescence when cells stop dividing. This process is linked to aging and has been associated with age-related cognitive decline. Shortened telomeres are often found in individuals with conditions like Alzheimer's disease, suggesting that telomere attrition could contribute to cognitive decline. Wear and tear theories. The wear and tear theory suggests that aging results from the cumulative damage to the body over time. This damage can be caused by environmental stressors, lifestyle factors, and the normal processes of metabolism. Key components of this theory include 1. Oxidative stress theory. This theory suggests that aging is caused by the accumulation of free radicals, unstable molecules, that cause oxidative damage to cells and tissues. The mitochondria, the energy-producing structures within cells, are particularly vulnerable to oxidative stress, which can impair cellular function and contribute to age-related cognitive decline. Over time, the damage caused by oxidative stress can lead to the degeneration of brain cells, impairing cognitive functions such as memory, attention, and problem-solving. 2. Mitochondrial dysfunction. Mitochondria, as the powerhouses of the cell, play a critical role in cellular energy production. As individuals age, mitochondrial function tends to decline. This results in less energy available for brain cells, contributing to cognitive decline. Mitochondrial dysfunction has been strongly associated with neurodegenerative diseases like Alzheimer's and Parkinson's disease. 3. Inflammation. Chronic inflammation has been linked to aging and cognitive decline. As we age, the immune system becomes less efficient, leading to inflammaging, a term used to describe the low-grade chronic inflammation that is common in older adults. Inflammation can damage neurons and disrupt neurotransmission, which may contribute to cognitive decline and increase the risk for diseases like Alzheimer's and dementia. See evolutionary theories of aging. 1. Disposable soma theory. This theory suggests that aging occurs because the body prioritizes reproduction over maintenance of the body's systems. The disposable soma refers to the idea that the body's resources are allocated to reproduction, rather than cellular repair and maintenance, which leads to aging-related deterioration over time. 2. Antagonistic pleiotropy theory. According to this theory, certain genes that promote reproduction early in life may have harmful effects later in life. These genes may be beneficial during an individual's reproductive years, but as individuals age, the effects of these genes may become detrimental, contributing to age-related decline. 2. Biological changes in the brain with aging. Aging affects various parts of the brain, leading to structural and functional changes. These changes contribute to cognitive decline and can explain many of the symptoms associated with aging, such as memory loss, difficulty concentrating, and slower processing speeds. Structural changes in the brain. 1. Shrinkage of brain regions. Cortex. The outer layer of the brain, the cortex, thins with age, especially in regions related to memory and cognitive functions, such as the prefrontal cortex and hippocampus. This shrinkage can impact executive functions like planning, decision-making, and impulse control. Hippocampus. The hippocampus, which is involved in memory formation, is particularly vulnerable to age-related changes. It shrinks over time, which contributes to memory problems commonly seen in older adults. White matter changes. White matter, which facilitates communication between different parts of the brain, tends to degrade with age. This is known as white matter hyperintensities and is associated with cognitive decline, particularly in processing speed and attention. 2. Neurodegeneration. With aging, neurons may degenerate and die. This process is particularly evident in neurodegenerative diseases, such as Alzheimer's disease and Parkinson's disease, where there is significant loss of neurons in regions of the brain responsible for memory, movement, and cognition. Neurochemical changes. 1. Decreased neurotransmitter activity. Aging is associated with a decline in the production and function of neurotransmitters like acetylcholine, dopamine, and serotonin, which play a crucial role in memory, attention, mood regulation, and motor function. These decreases contribute to cognitive decline, especially in conditions like Alzheimer's disease and Parkinson's disease. 2. Reduction in neurogenesis. Neurogenesis, or the creation of new neurons, slows down with age. This process is most active in the hippocampus, which is crucial for memory formation. A reduction in neurogenesis can contribute to the cognitive decline seen in older adults. See vascular aging. 1. Cerebrovascular changes. Aging can affect the blood vessels that supply the brain, leading to conditions like vascular dementia, which results from impaired blood flow to the brain. Reduced blood flow can cause oxygen and nutrient deprivation in brain cells, leading to cognitive decline. 2. Blood-brain barrier integrity. The blood-brain barrier, BBB, serves as a filter to protect the brain from harmful substances in the blood. With aging, the integrity of the BBB declines, potentially allowing toxins and pathogens to enter the brain and contribute to neurodegenerative diseases. 3. Implications for cognitive decline and intervention. Understanding the biological underpinnings of aging provides important insights into how we can potentially slow down cognitive decline or intervene early. Some of the strategies to support brain health in aging adults include: 1. Exercise and physical activity. Regular physical activity, particularly aerobic exercises like walking and swimming, has been shown to stimulate neurogenesis and improve brain plasticity, helping to protect against age-related cognitive decline. 2. Healthy diet. A diet rich in antioxidants, omega-3 fatty acids, and other brain-healthy nutrients can help reduce oxidative stress and inflammation, which are key factors in cognitive aging. 3. Cognitive training. Engaging in mentally stimulating activities, such as puzzles, learning new skills, and engaging in lifelong learning, can enhance cognitive reserve, which can delay the onset of cognitive decline. 4. Pharmacological interventions. While there are currently no cures for age-related cognitive decline, pharmacological interventions, such as cholinesterase inhibitors, have shown promise in managing symptoms of Alzheimer's disease and similar conditions. 4. Emerging areas of research. As research in aging continues to evolve, several emerging areas show promise for improving our understanding of the biological processes of aging and how to protect cognitive function. 1. Stem cell therapy. Stem cells have the potential to regenerate damaged brain tissue, and research into stem cell therapy for age-related cognitive decline is a rapidly growing field. Though still in early stages, this research holds the potential to offer new treatments for neurodegenerative diseases. 2. Gene therapy and epigenetics. Advances in gene editing and epigenetic research may eventually allow scientists to reverse or delay the aging process at the molecular level, potentially reducing cognitive decline. 3. Neuroinflammation and immune system modulation. Targeting inflammation within the brain and modulating the immune system may offer new avenues for treating conditions like Alzheimer's disease and other neurodegenerative disorders. Conclusion. In this class, we explored the biological mechanisms underlying aging and how these processes contribute to cognitive decline. We discussed genetic theories, wear and tear theories, and evolutionary theories of aging, as well as the biological changes in the brain that occur with aging. By understanding the biological foundations of cognitive decline, we can better inform interventions that help preserve cognitive function in older adults. In our next class, we will turn our attention to neurodegenerative diseases like Alzheimer's and Parkinson's, examining the biological and psychological factors that contribute to these conditions. End of Class 28. Class 29 Lecture: Neurodegenerative Diseases, Alzheimer's and Parkinson's Disease. Introduction. Welcome to Class 29 of Advanced Developmental Psychology. Today, we will explore two of the most prominent neurodegenerative diseases that affect cognitive and motor functions in older adults: Alzheimer's disease and Parkinson's disease. Both conditions are characterized by progressive deterioration of neurological function, but they differ in terms of their underlying causes, symptoms, and treatments. This class will help you understand the biological, psychological, and social impacts of these diseases, as well as current approaches to managing them. By the end of this lecture, you should be able to differentiate between Alzheimer's disease and Parkinson's disease, understand the biological mechanisms behind these diseases, recognize the cognitive, emotional, and behavioral symptoms associated with both conditions, explore the current treatment options and emerging research on these neurodegenerative disorders. 1. Overview of neurodegenerative diseases. Neurodegenerative diseases are conditions that involve the progressive degeneration of the nervous system, particularly the brain. These diseases often have a slow onset and worsen over time, leading to significant impairments in cognitive, motor, and emotional functioning. While Alzheimer's disease and Parkinson's disease are among the most common neurodegenerative disorders, there are several others, including Huntington's disease and amyotrophic lateral sclerosis, ALS. Key features of neurodegenerative diseases. Progressive decline. Symptoms worsen gradually, often over years or decades. Irreversible damage. Brain cells degenerate and die, leading to permanent loss of function. Impact on quality of life. These diseases have profound effects on the individual, their caregivers, and the broader social network. 2. Alzheimer's disease, AD. Overview and epidemiology. Alzheimer's disease is the most common form of dementia, accounting for 60 to 80% of dementia cases worldwide. It primarily affects older adults, with the majority of cases emerging after the age of 65, though early onset Alzheimer's can occur in individuals as young as 40 or 50. The disease is characterized by a gradual decline in memory, thinking, and reasoning skills. Prevalence. In the United States, approximately 5.8 million people are living with Alzheimer's disease. This number is expected to rise as the population ages. Impact on caregivers. Alzheimer's places a significant emotional, financial, and physical burden on caregivers, typically family members, who provide care for individuals with the disease. Biological mechanisms. The exact cause of Alzheimer's disease is not fully understood, but several biological factors contribute to its development. 1. Amyloid plaques. One of the hallmarks of Alzheimer's is the accumulation of amyloid beta plaques in the brain. These plaques are abnormal clumps of protein that form between nerve cells, disrupting communication, and leading to inflammation and cell death. 2. Tau tangles. Another key feature of Alzheimer's is the presence of tau protein tangles within neurons. Tau is responsible for stabilizing microtubules, which help transport nutrients and other materials within cells. In Alzheimer's, tau becomes abnormally phosphorylated, causing it to aggregate into tangles, disrupting the normal functioning of neurons. 3. Neuroinflammation. The immune system in the brain becomes activated in Alzheimer's, leading to chronic inflammation. This inflammation may contribute to neuronal damage and accelerate cognitive decline. 4. Acetylcholine deficiency. Alzheimer's disease is also associated with a reduction in acetylcholine, a neurotransmitter that is crucial for learning and memory. This deficiency contributes to cognitive symptoms, particularly memory loss. See symptoms and progression. Alzheimer's disease progresses in stages, with the severity of symptoms increasing over time. Early stage. Mild memory loss, especially for recent events, confusion, and difficulty finding words. The individual may also experience mood changes, including anxiety or depression. Middle stage. Increased memory loss and confusion. Individuals may have trouble recognizing loved ones, lose the ability to perform everyday tasks, and experience significant mood swings, aggression, or paranoia. Late stage. Severe memory loss, inability to communicate, loss of motor skills, and complete dependence on caregivers. Individuals may lose the ability to recognize familiar faces and may become bedridden. Treatment and management. There is currently no cure for Alzheimer's disease, but several approaches are used to manage symptoms and improve quality of life. 1. Medications. Cholinesterase inhibitors, e.g., donepezil, rivastigmine, can help increase acetylcholine levels in the brain, improving memory and cognitive function in the early to middle stages. Glutamate regulators, e.g., memantine, can help prevent excess glutamate from damaging neurons, providing some relief in moderate to severe stages. 2. Non-pharmacological interventions. Cognitive training and behavioral therapy can help individuals maintain cognitive function and manage behavioral symptoms. Caregiver support programs are essential for providing emotional and practical support to those caring for individuals with Alzheimer's. Emerging research and future directions. Research on Alzheimer's disease is ongoing, with several areas of focus. Immunotherapy, exploring the use of antibodies to target amyloid plaques and tau tangles in the brain. Gene therapy, investigating the role of genetic mutations, such as in the APOE4 gene, and the potential for gene editing to prevent or slow the progression of Alzheimer's. Stem cell therapy. Research into using stem cells to replace damaged neurons and restore brain function. 3. Parkinson's disease (PD). A. Overview and epidemiology. Parkinson's disease is the second most common neurodegenerative disorder after Alzheimer's. It primarily affects motor function, leading to symptoms such as tremors, rigidity, bradykinesia, slowness of movement, and postural instability. Prevalence. Approximately 1 million people in the United States have Parkinson's disease. It is more common in men than women, and typically manifests in individuals over the age of 60, although early onset Parkinson's, before age 50, is also possible. Progression. Parkinson's disease progresses more slowly than Alzheimer's, and individuals can live for years or even decades with the condition, although quality of life may decline as symptoms worsen. B. Biological mechanisms. Parkinson's disease is characterized by the degeneration of dopamine-producing neurons in the substantia nigra, a part of the brain involved in motor control. This leads to a reduction in dopamine levels, which impairs the brain's ability to control voluntary movements. 1. Loss of dopamine. Dopamine is a neurotransmitter that helps regulate movement. The loss of dopamine-producing neurons leads to the hallmark motor symptoms of Parkinson's, including tremors, rigidity, and bradykinesia. 2. Lewy bodies. Parkinson's disease is associated with the accumulation of Lewy bodies, abnormal clumps of alpha-synuclein protein that disrupt neuronal function and contribute to cell death. 3. Neuroinflammation. Like Alzheimer's, Parkinson's is also associated with chronic neuroinflammation, which may exacerbate the disease and contribute to the progressive loss of neurons. See symptoms and progression. Parkinson's disease is primarily marked by motor symptoms, but non-motor symptoms are also common. Motor symptoms. Tremors, involuntary shaking, typically starting in one hand. Bradykinesia, slowness of movement, making it difficult to initiate or complete tasks. Rigidity, stiffness in the muscles, leading to discomfort and difficulty with movement. Postural instability, difficulty maintaining balance, leading to falls. Non-motor symptoms. Cognitive impairment, memory problems and executive function deficits, especially in later stages of the disease. Depression and anxiety, common emotional symptoms in individuals with Parkinson's. Sleep disturbances, difficulty sleeping and restless leg syndrome. D. Treatment and management. While there is no cure for Parkinson's disease, treatments are available to manage symptoms. 1. Medications. Levodopa, L-Dopa, is the most effective medication for Parkinson's, as it is converted into dopamine in the brain. However, long-term use can lead to motor complications such as dyskinesia and involuntary movements. Dopamine agonists. These medications mimic the effects of dopamine in the brain and can be used in conjunction with levodopa to enhance its effectiveness. MAO-B inhibitors. These medications help prevent the breakdown of dopamine in the brain, prolonging its effects. 2. Surgical interventions. Deep brain stimulation. DBS is a surgical procedure in which electrodes are implanted in specific brain areas to help regulate abnormal brain activity and improve motor function. 3. Physical and occupational therapy. Regular exercise and physical therapy can help improve motor function and maintain mobility. Occupational therapy can assist with strategies to manage daily activities and maintain independence. Emerging research and future directions. Emerging research on Parkinson's disease is focused on several areas. Gene therapy, investigating ways to restore dopamine production in the brain through gene therapy or the introduction of new genes. Stem cell therapy, researching the potential to replace damaged neurons with stem cells to restore motor function. Neuroprotective agents, developing drugs that can protect dopamine-producing neurons from damage and slow disease progression. 4. Conclusion. In this class, we explored Alzheimer's disease and Parkinson's disease, two of the most common neurodegenerative conditions affecting older adults. We examined their biological underpinnings, symptoms, and treatments. While both diseases present significant challenges to individuals and caregivers, ongoing research is paving the way for potential treatments that could slow or even reverse some of the damage caused by these conditions. In our next class, we will look into non-neurodegenerative cognitive disorders and the psychological interventions used to manage these conditions. End of class 29.